Hyperthyroidism will have the opposite symptomatology of hypothyroidism. You will not be able to tolerate heat well. You may be very thin. You may be anxious. You may have muscle tremors. You may have amenorrhea. You might be plagued by tachycardia and increased blood pressure. You might end up with a goiter. You might feel hyperactive. Overall, your BMR is going to go up. There is also what is known as exophthalmos associated with hyperthyroidism, and that is because of the fact that your blood pressure is going to be higher. So that means that the arterioles that are posterior to your eye will actually be pressing on or putting pressure on your eyes and making them look like what you see in that diagram, in quotes, bugging out, end quotes. The autoimmune version of hyperthyroidism is Graves' disease. And the antibodies are going to actually impact the TSH receptors on thyroid cells. So it is a receptor issue, and TSH is involved, not T3, T4, but because you are producing crazy amounts of T3, T4, you'll end up with the symptoms of hyperthyroidism. Fun facts about hyperthyroidism: not a huge number of people are impacted by this. Graves' disease, about 1% of Americans. More common in men, more common in women than in men. And if you're older, higher possibility, you have a greater risk. And also higher risk for 6 months after pregnancy and birth. Amazing, fascinating. We're going to switch gears here and talk about calcitonin. We mentioned before that the extrafollicular C cells, which are outside of the follicles, they are not in the follicle walls or within the follicles, they are outside of the follicles. Those are the ones that are going to produce calcitonin. So they might be known as parafollicular cells or parafollicular C cells or superfollicular cells. If you hear something that implies there's something else going on in the thyroid outside of those follicles, you're talking about calcitonin. So if your body detects an increased concentration of calcium in the blood, this will be released. It is going to stimulate osteoblasts to lay down more bone matrix. It will inhibit the functions of osteoclasts, which means there will be less bone matrix and therefore calcium released. It will also work on parts of the nephron in the kidneys, which are known as the distal convoluted tubules, to trigger the secretion of excess levels of calcium, and you will urinate those out. Its job is to decrease blood calcium levels. Please remember that. We're going to also talk about the parathyroid glands, which are small glands. There are 4 of them that are going to be embedded in the posterior aspect of the thyroid. They contain what are known as chief cells. Their job is to produce parathyroid hormone, PTH. Parathyroid hormone is the primary regulator of circulating calcium ion concentrations. Let me repeat that. PTH is the main or primary regulator of the calcium ion concentrations that you will find in the blood. I would know that if I were you, forever, not just for this class. So when you have insufficient blood calcium circulating around, PTH will be released. Its job is to increase those calcium levels back to normal. It will tell osteoclasts, break down bone, and release more calcium out of that bone matrix. It'll tell osteoblasts, stop working so hard and laying down bone matrix. It will trigger the distal convoluted tubules of the kidneys to pull calcium back into the circulatory system. And it will also tell the small intestine, hey, we need calcium. So increase more calcium absorption. You need both PTH and calcitonin to maintain the appropriate levels of calcium in the blood. And this shows you what you need to know. And I would memorize this chart and know it cold for the assessments. And forever, actually. So we need to talk about pathologies of the parathyroid glands. Hyperparathyroidism, once again, primarily in females. Look at the symptoms: fatigue, muscle weakness, arthralgia, fancy term for joint pain, osteopenia, osteoporosis, kidney stone, fatigue, depression, forgetfulness, nausea, vomiting, loss of appetite. If you take a look at these symptoms and these symptoms, particularly fatigue, depression, forgetfulness, nausea, and vomiting, loss of appetite, that could be associated with a whole bunch of different endocrine disorders and other stuff too. And that's a reminder, because endocrinology is a really tough field because of the sort of vague and diffuse symptoms that can be associated with a number of other pathologies. Usually a tumor of the parathyroid glands triggers this. Hypoparathyroidism, fortunately, is relatively uncommon. Look at the symptomatology: muscle cramps, twitches, seizures, tingling, burning in fingers. Wait, isn't that carpal tunnel? Not necessarily. Fatigue, weakness, dry, coarse skin, etc., etc. Yeah, a lot of these signs and symptoms can go hand in hand with a number of other pathologies.